First aid friends. What comes first, a call to 911 or first aid? Be prepared to help others in a medical emergency. Responding quickly to an emergency is critical because the initial moments of an incident are often the most crucial for saving lives, minimizing damage, and preventing further complications. Every minute counts, and prompt action can significantly improve the outcome of a dangerous situation. However, not every emergency is the same. In some situations, a call to 911 is necessary for immediate help from medical professionals and prompt transportation to a hospital for treatment. In contrast, other emergencies can be managed on the spot with first aid, and the person can be monitored at home. Do you know which emergencies require a call to 911, and which ones can be handled at home using first aid? Hello! I'm Emerson. I'm here to teach you how to decide whether to call 911 right away in an emergency or to perform first aid at home, monitor the situation, and get professional medical care later if needed. Come along now. Take a deep breath and keep calm so you can do your best thinking. Helping someone during an emergency can be stressful. But if you get panicked, you can make the situation much worse. Immediately call 911 if a friend or family member has a wound that is bleeding uncontrollably, which means that the wound won't stop bleeding even when it's covered with a cloth or bandage and direct pressure is applied. After calling 911, keep the wound covered and continue to apply pressure until medical professionals arrive. Immediately call 911 if a friend or family member is experiencing sudden or severe chest pain, especially accompanied by shortness of breath. Immediately call 911 if a friend or family member is having trouble breathing, gasping for air, or wheezing. Immediately call 911 if a friend or family member chokes on food or another object blocks the airway and they are unable to breathe. Once paramedics are on the way, you can start administering first aid until medical professionals arrive. Immediately call 911 if a friend or family member is unconscious or unresponsive. Once paramedics are on the way, you can start administering first aid and CPR until medical professionals arrive. If you don't know CPR, the 911 dispatcher can guide you through the steps. Immediately call 911 if a friend or family member suffers a serious head injury. Look out for symptoms like confusion, vomiting, or seizures, and report them to the paramedics when they arrive. While waiting for paramedics, keep the individual still, and at the same time try to keep them alert and monitor their breathing. If there are any bleeding wounds, cover them with a clean cloth if possible, and apply pressure until medical professionals arrive. Immediately call 911 if a friend or family member suffers a deep or large burn. A deep burn penetrates through the layers of skin to the muscle. A large burn is one that covers a large area of the body. Immediately call 911 if a friend or family member suddenly experiences numbness or weakness on one side of the body, slurred speech, or vision problems. They might be having a stroke. Immediately call 911 if a friend or family member experiences a severe allergic reaction to food, a bee sting, or medication. Watch for rapid swelling of the face, lips, or throat, along with difficulty breathing. They may also develop hives, itchy bumps across their body. If you are trained to use the person's EpiPen, administer it while you await the arrival of medical professionals. Now that you know when to call 911, let's look at first aid situations that can be managed at home. After giving first aid, it's important to monitor the injured person's symptoms and seek medical attention if their condition worsens. Minor cuts and scrapes can usually be treated at home. However, if you observe any signs of infection like redness or pus oozing out of the wound, it's important to seek medical attention. Minor sprains and strains can typically be managed at home. However, if you notice any of the following symptoms: intense pain, difficulty bearing weight on the affected area, considerable swelling, numbness, noticeable deformity, increased pain, or signs of infection such as redness, warmth, or fever, or if the pain does not improve after a few days of home care, it is crucial to seek medical attention. Minor burns can typically be treated at home and will heal on their own. However, minor burns affecting sensitive areas, eyes, mouth, hands, or minor burns that are not healing properly may need extra medical attention. Babies and the elderly may react more severely to minor burns and should see a doctor after first aid is given. Nosebleeds can be treated at home. They are generally not a serious health concern, even though they may feel scary to the child experiencing them. Nosebleeds happen when a small blood vessel inside the nose bursts, causing blood to flow out of the nostrils. The most effective way to stop a nosebleed is to apply direct pressure to the nostrils for 10 to 15 minutes. Most insect bites and stings are harmless and can be managed at home with pain relievers, ice packs, and soothing lotions. However, certain bites may cause severe allergic reactions that can be life-threatening. You should seek medical attention for insect bites and stings if the bite occurred in your mouth, throat, or near your eyes. You have a history of severe allergic reactions to insect bites, you were stung multiple times, or an abscess develops and does not improve with home treatment. Thanks for joining me today for this first aid training. I hope you feel more confident in knowing when to call 911 and in your first aid skills so you can help someone in an emergency. Bye for now!